Nurse anesthesia specialists are considered an integral part of patient care. It is a specialty that is comprised of nurses with advanced education in the science and art of anesthesia. They possess the core competencies to practice nursing, the experience in the critical areas, and the compassionate care inherent in being a nurse. They have undergone extensive training to be able to integrate their professional competencies with theories, techniques, and skills in anesthesia care. This group of nurses has become an essential component of the anesthesia care team, working closely with the supervising anesthesiologist to provide the safest anesthesia care to patients across the lifespan. The majority of the nurse anesthesia specialist work in collaboration with the anesthesiologist is largely related to operative procedures. The first step in their role in the operative setting is evaluation of the patient prior to anesthesia. This includes reviewing the patient's history, facilitating diagnostic tests and consultations, interviewing the patient, obtaining informed consent for anesthesia, or assuring that informed consent has been obtained, and making sure preoperative medications and fluids are calculated and tailored to the specific need of the patient. They work with a supervising anesthesiologist who is responsible for the formulation and implementation of the anesthesia care plan, which should detail the needs, treatment, and expected outcomes for the patient. Together, they assess the risk and benefits of each type of anesthesia in the context of the individual patient. The anesthetist is also responsible for carefully checking equipment such as the anesthesia machine, mechanical ventilator, and oxygen equipment for safety and functionality prior to any procedure. Vital signs, pulse oximetry, heart monitors, and monitors on oxygen and ventilation systems are examples of methods for monitoring the patient's response and status of equipment. After the procedure is complete, the nurse anesthesia specialist remains involved in extubation, assessing emergence and initial recovery from anesthesia. They work closely with the recovery room team in the continuous monitoring and observation of the patient. They remain vigilant for any anesthesia side effects related to the anesthesia plan employed and do prompt referral when needed. In addition to the more traditional roles related to surgery, nurse anesthesia specialists are prepared to administer emergency care in any setting, including airway management, fluid and medication administration, and other interventions requiring advanced cardiac life support skills. They may participate in the areas of respiratory care and are required to respond to cardiac arrest codes when they occur with patients in the emergency department, ICU, or the general floors.